Good afternoon and welcome to the COVID-19 update on Channels Television. I am Kayode Okikiolu. Here are some of the highlights. As Nigeria crosses the 50,000 COVID-19 cases mark, there are concerns about the possibility of a resurgence or what has been called a second wave. More innovations to combat COVID-19, this time from Plateau State, where 3 young innovators build a chamber with some cool safety features. And several countries in Europe are reporting their highest cases in months. Is this the much talked about second wave, or is there something else responsible? Well, thank you for joining us on the program. Nigeria has recorded a significant spike in its daily COVID-19 cases as 593 samples came back positive for the novel coronavirus in the last 24 hours. The last time Nigeria recorded over 500 cases was on Tuesday, July the 28th, with 624 cases. And ever since then, we've averaged less than 400 daily cases. It is not yet clear what caused this spike as Nigeria gradually reopens economic, religious and social activities, with worship centers, schools and other public places coming back to life. 50,488 cases of COVID-19 have been confirmed so far, with 37,304 discharged and 985 deaths. A breakdown of the latest figures as released by the NCDC shows 15 states and the FCT account for the 593 cases. Plateau State with 186, Lagos with 172, FCT 62 cases, Oyo 27, Delta 25, Rivers 20, Ondo 19, Edo 18, Kaduna 17, Enugu 12, Akwa Ibom 10, Ogun 7, Abia and Gombe 6 cases, and Kano and Osun 3 cases each. We'll take a look at this automatic disinfectant chamber built by 3 youngsters from Jos, Plateau State in the north-central region of Nigeria as part of research to curtail the spread of COVID-19. Now, what's unique about this chamber is that it only allows persons with face masks access into public places where such chambers are installed. It took William Gang and his team 3 months to build this chamber after they had resuscitated moribund ventilators at the Jos University Teaching Hospital. The fully automated system is set to have an instant temperature test, data recording system with full body disinfectant, as well as automatic hand sanitizers.
Stand in front of the camera for proper face processing. You are welcome.
On this, the system has a motion detecting sensor. I also have a camera where you process the image and check whether the person is having face mask or is not having face mask before it allows the doors to open automatically. So, and the system is fully automated. So one of the main reasons of making it fully automated is to avoid any form of contact. So in the system there's no form of contact where you need your hands to open the curtain or you need your hands to open the door and the rest. So everything is being designed, and the system also have a software where you can control the system remotely from anywhere, and you can also view and record most of the information happening in front of this. So if there's any form of manipulation or to manipulate the system, there's a recording video on it where the security person in charge or the ICT person in charge will actually notify the individual.
A person with disabilities, fully body disinfectant, instantly temperature test, and it's notchless, automatic hand sanitizer, automatic cooling system, self-evacuation, wireless communication, operating without third person.
Great work. Following the rise in COVID-19 cases in Cross River State, the government has renovated a healthcare facility in Akampa local government area to help contain the spread of the virus. The state's Director General of the Primary Healthcare Development Agency, Dr. Janet Ekpayong, explains that the facility will help discourage residents from patronizing quacks at the expense of their lives. She's asking residents of the area to take advantage of the facility and also protect it from being vandalized.
Cross River Primary Healthcare Agency is very excited because this is a new addition to the agency where we are still going to improve healthcare delivery to the people of Akampa and to the community of Mbebwe. So we are really excited, and we are going to see how we can send healthcare workers to this facility to see how they can improve antenatal care services, improve immunization services, and all the PHC services in this facility. We will continue to work together to ensure that the facility is fully equipped to provide all the needed services.
Well, let's head over to Ekiti State, where some COVID-19 patients are up for medications offered by some private physicians, and the state's task force is frowning at this. The task force insists that the safest mode of treating such patients is at an approved isolation center, warning that other alternatives may backfire. The state has so far recorded over 200 cases, while community testing is ongoing. Our correspondent, Babajide Agbeyo, brings this update.
The Ekiti State COVID-19 Task Force has warned that no physician is expected to make or recommend any immune booster or some combinations for COVID-19 patients as alternative to proper isolation and treatment. The task force is worried that some patients who initially refused to report for treatment in the course of the ongoing community testing across the state were later discovered to be taking some medications facilitated by some unauthorized sources.
It is not allowed for any private physician to treat COVID-19 positive patients. The only centers that are approved to treat COVID-19 positive, you have to be licensed. There's a process. In Ekiti State, the only place that is allowed is the government, the isolation center, and when we have our people in tertiary institution, there's collaboration with the doctors that are trained to treat, and they are the ones managing those patients. So no private hospital is licensed to treat COVID-19 patients in Ekiti State.
Meanwhile, the task force has been going around centers for the ongoing senior school certificate examinations to ensure compliance with set protocols. It also says it will continue its monitoring of religious centers, which resumed last week, to make sure they comply with all the rules. Babajide Agbeyo for COVID-19 update.
Well, Dr. Chidumga Ozurike is a public health physician, and she joins us this afternoon on the program. Thank you for your time. Well, you may have caught that report from Ekiti State where some people are seeking, medical care and prescriptions from private healthcare practitioners. And, it just brings to fore people's health-seeking behavior. Talk about self-medication and what have you. Just how much of a challenge is that, if we could begin on that note?
Thank you, Kayode, for that great question. I think it's important for healthcare practitioners to be very wary of what they try to do at this time. Because as we all know, COVID-19 has very similar symptoms with different diseases that we already have or that are already endemic in Nigeria. They are enjoying to have very high level of suspicion, concerning COVID-19, the symptoms that are specific and non-specific to COVID-19 has been widely disseminated by the NCDC. Healthcare practitioners are warned to, be wary of their practices at this time. This is not the time to make quick money because you may be putting yourself and your staff and even your family and loved ones at risk if you keep on treating COVID-19 cases without channeling them appropriately.
That's a point to note there. But let's just talk about a wider outlook to this pandemic and maybe what we can learn from other countries. So Europe, for example, is imposing restrictions after opening up. We saw pictures from Wuhan in China earlier in the week where hundreds of people partied together without face masks. And here in Africa, we're gradually opening up. What is Africa's outlook, really?
I think, as we all know again, Africa is behind almost every other continent in the cases that we have in the pandemic, you know. And even in Africa, South Africa seems to be really leading in the numbers for COVID-19. Howbeit, the pandemic is unfolding slowly, but gradually in Africa. It is yet to be seen whether we would have the kind of numbers that we have in Europe, you know. But it seems, as of now, as of August, that Africa seems to be spared by having such large cases, possibly due to the young population that we have and the nature of COVID-19 having been a disease with a range of presentations. So you can have from asymptomatic presentation to very severe presentations. So it's research needs to go on very quickly in Africa for us to determine what model, you know, of transmission is happening in Africa, and so that way we would be able to determine whether we would unfold like Europe. But for now, we don't have an answer to that question.
It's interesting you actually talk about research, and you know, clearly we have a lot of work to do in that area. But I'm thinking now, if the cases continue to rise, for example, recorded over 500 cases in the past 24 hours, we don't hope for that, but if that's the case, how's our health system really? Do you see us building enough capacity to handle a possible resurgence?
Again, Nigeria has tried to build up capacity of healthcare workers to respond to the pandemic across the 36 states and the FCT. 500 is still very few, you know, for across the 36 states. So that's not a problem now. But the question would be, if we get into the millions like it is in the US, what would happen? But at the same time, having put in enough, the amount of resources, which is still ongoing into the response in the pandemic, it is hopeful, really, the word is hopeful. It is hopeful that those resources will be used, you know, efficiently, you know, and effectively to respond to the pandemic. But we'll watch and see how it unfolds, basically.
You know what they say about hope not being a strategy, but some think it is. But I'd like to quickly get your thoughts on this, you know, protest, demands by some tertiary institution students. It was yesterday, demanding that their schools be reopened, mainly government-owned tertiary institutions across the country. They cited, you know, worship centers, they cited other businesses that have opened, and they wonder, why aren't their schools opened just yet? I'd like to get your thoughts on that. What do you think?
Okay, so I would like to quote Mike Ryan, who is the WHO lead on the COVID-19 pandemic, and what he said. You know, what determines what you reopen in each country determines on the level of community transmission. And for you to continue to open up, you can see we're opening up very gradually. Your positivity rates has to be less than 5%. Nigeria is still hovering around 10% to 12% positivity rates. And so for positivity rates that are that high, it means you have to remain cautious as you open. Our tertiary institutions are very peculiar, especially in their living situations. So I think we still need the strategy to work out how it will be, especially for the living areas in the hostels in these tertiary institutions. So it is something that has to be worked out very, very gradually, you know, so that you don't put these same students at risk, you know, because our universities as they are, or as our higher learning centers as they are overpopulated, you know, and putting in social distancing measures and other healthcare measures or other public health measures in those institutions may be a challenge if they are not properly planned, and we don't want to witness spikes coming from those institutions.
So we have to keep our eyes on that positivity rate and ensure that we bring it down, right?
Yes, as much as possible.
Okay, man. Great words there, Dr. Chidunga Ohazurike, public health physician. Thank you so much for sharing your thoughts this afternoon.
Thank you very much, Coyote.
When we return, we'll bring you the COVID-19 situation in Europe, where not one, not two, but several countries are witnessing a spike in cases. To join us again. You're welcome back. Well, as we keep our eyes on the COVID-19 pandemic, the World Health Organization in Yobe State is also paying attention to other infectious diseases like cholera as part of efforts to protect the entire populace from outbreak of any infectious diseases. The WHO, under its Health Emergencies Program, is donating drugs, cholera kits, as well as commodities to the state government. Presenting the items in Damaturu, the state capital, the WHO program manager in the Northeast, Dr. Collins Owili, represented by Dr. Ibrahim Salisu, says the WHO is complementing the efforts of the state government amidst the coronavirus pandemic to boost preparedness and protect the entire populace during the rainy season.
The State Ministry of Health and WHO are currently leading COVID-19 control efforts in order to mitigate its health and social impact. So as part of the effort to protect the populace, we are currently working on cholera preparedness in this rainy season. We are working with partners to ensure that cholera has not occurred in the state. And even if it does occur, we are well prepared with trained healthcare workers, with adequate drugs and commodities, and laboratory supplies to ensure that people that are infected are treated promptly and adequately.
I wish to appreciate the World Health Organization for this donation of drugs, cholera testing kits, intravenous fluids and equipment that will be used during an outbreak of gastroenteritis, specifically cholera in the state. A lot of these items can also be used for other diseases. We've also received anti-malarials and some antibiotics that we can actually use for other diseases. So as such, we're very grateful to the World Health Organization. Historically, we've always been in partnership, and WHO has always supported the state in its critical areas of need.
Dr. Olatunia Lusimadi joins us this afternoon in our studios. He is a general practitioner, public health physician, and a medical director at Solo Estate Clinic. Well, thank you for your time this afternoon. Let's see if we can pick it up from where we left off with Dr. Chidumga. She was talking about our positivity rate, and just yesterday, the NCDC reported about 593 COVID-19 cases, and that's our highest in about 3 weeks. We don't quite know what is responsible for that, but what are the possibilities, really?
Thank you for inviting me. I have my concerns about the figures that we quote in Nigeria. When we are talking about COVID-19, the statistics are very, very important. You must know that there are percentages of people who have COVID-19 and who are completely asymptomatic. That is probably more important. We must do a lot of ramping up of the testing to such an extent that you know the percentage of people that are asymptomatic. What we are talking about are people who fall sick and are tested and are found to have COVID-19. That cannot tell us the burden of the COVID-19 pandemic to the credit of Nigeria. We are just talking about the cases that we see. Why I'm saying that is that, first, COVID-19 is going to be with us for years, for a very long time.
So you don't believe, you don't go with people that say in the next 6 months or 1 year it will be over?
It is now known all over the world. Don't forget that this is not the first pandemic. It is not going to be the last pandemic. Why I'm saying this is that it is good at the level of government and policy making to begin to prepare, to begin our way of life, to be ready for any kind of pandemic that may come in the future. For example, we are talking about physical distancing. We are talking about measures to prevent hand washing and things like that. But people, if you look at higher institutions, they stopped working. A lot of the higher institutions abroad just went on IT, and the lectures continue.
That's online learning, right?
And I can assure you there are a lot of Nigerians who are caught in Nigeria, who are students abroad, Since March, they have graduated to final year, and their schools are ongoing. So this COVID-19 is indirectly telling all of us, including government, to begin to put in policies that will absorb some of these shocks. For example, the banks, they have their servers, and you can do remote banking. The universities, the educational system should be able to do that. Look at the issue of the school start that people are going to go for. The private schools have done 2 exams, and they are fully prepared for this WAEC that is coming. I hope the public schools. So what I'm saying in general is that we should allow science to lead us. Any figure you quote in Nigeria, how many have we tested? Nigeria is more than 150 million. We have not tested 1 million.
Clearly, we're not testing enough.
It is when you test that you know the burden. And it is when you know the burden that you can now begin to make decisions and policies. For example, this is not the time to say you want to go and visit somebody in an hospital. It's not the time. You can see that people are doing Zoom meetings, Zoom weddings, Zoom burial, and things like that. These are some of the things that will begin to imbibe, not for now, but in the future. A lot of people now are working at home, and they are even finding it more convenient.
So basically, this is not going to be a sprint. It's more of an endurance marathon sort of thing. Oh, thank you so much, Dr. Olatunia Lusimadi, General Practitioner, Public Health Physician. Thank you for your thoughts this afternoon.
It's a pleasure.
Well, let's head outside Nigeria, where countries across Europe are reporting a surge in coronavirus cases, with several posting their highest figures in months. Spain, Italy, and Germany all recorded their highest number of infections since June, May, and April. However, several European countries have introduced travel restrictions in addition to measures to curb the spread of the virus. Here's more on our global update.
New Zealand's Prime Minister Jacinda Ardern wore masks and protective clothing on Thursday as she visited the Institute of Environmental Science and Research, where scientists have been mapping coronavirus genomes. PM Ardern talked to scientists and researchers about how they hope to detect outbreaks around the country. The next few days will be critical for New Zealand to surpass the latest outbreak of COVID-19, as Wellington reported just a handful of new infections. South Korean health officials are struggling to contain an outbreak of the new coronavirus centered in the capital Seoul, as new cases leveled off. The Korean Center for Disease Control and Prevention, KCDC, reported 288 new cases as of midnight on Wednesday, marking at least a week of triple-digit daily increases. Overall, South Korea has reported 16,346 cases with 307 deaths. And there is a glimmer of hope in Chile as coronavirus cases dropped in Santiago. Chile's health minister says that in the past few days, COVID-19 cases have decreased by 11%. Like many Latin American nations, Chile has a large population of informal vendors who struggled after movement restrictions reduced their customers' space. Chile has over 388,000 confirmed cases and 10,546 deaths.
Well, let me show you something on our website at channelstv.com, where you can get access to all the latest updates on the pandemic. And all you need to do is log on and access the news in health, politics, business, sports, and other sectors you find important. Like this one, Germany records highest daily COVID-19 cases since April, and so much more. Well, that's the COVID-19 update. Thank you for watching. I am Kayode Okikyolu. Please stay safe.